Good afternoon, and thank you for joining me for another Leadership Rounds. I'm Dr. Mindy Estes, President and CEO of St. Luke's Health System in Kansas City and Board Chair of the American Hospital Association. This week, I'm pleased to be joined and introduce Rachelle Schultz, President and CEO of Winona Health, located in southeast Minnesota. Welcome, Rachelle.
Good to be here, Mindy.
Winona Health is an independent community health system comprised of a 49-bed hospital, a 110-bed nursing home, memory care, and other community-based services. Rachelle is on the board of the Minnesota Hospital Association, past chair and member of AHA's Small and Rural Committee, and personally, I've been pleased to work alongside you, Rachelle, as you've shared your expertise serving on the AHA's Pathways to Recovery Task Force. So again, thank you for joining me. And how about let's just jump right in.
Let's do it.
So COVID-19 has brought unprecedented challenges for the entire field, but at small rural hospitals, the challenges of fighting COVID can be particularly intense. Share with us how COVID has impacted Winona Health and more so, the health of your community.
Sure. Great question. And, I'm sure a lot of the things that we did up front were very similar to, other organizations and hospitals. We executed our emergency preparedness plans. We put a lot of, new plans in place. We looked at the surges. We tried to sort of guesstimate what, potentially could come given, everything that was coming out, so quickly, at the beginning. And I think we put some really great plans in place about how we could expand, care for people, how we could have more beds. We used the waivers. We did all of that, type of work in our clinics, the hospitals, and in our long-term care. But our first positive showed up on the 27th of March, and it was in a local nursing home. So, right after that, we got a couple more, same nursing home, a couple more, same nursing home. And, with our medical task force and administrators, together, we started really thinking about how do we prevent that surge and what's going on out there and really feeling like we were blinded to, what is in our community. And instead of waiting for the surge to come, how can we get in front of it? So, at that time, with that particular nursing home, and since then, of course, we know how hard nursing homes have been hit. We decided to actually, break a few of the rules around testing, if you will, and just go test everybody in that nursing home and staff and residents. And we found 21 more asymptomatic positives. And that just started, a lot of things for us across the community. For one, we actually took all of the non-infected residents and we moved them over to our campus at the hospital to give them the best chance to not get infected by that, by the disease or by the virus. And then we went out and we asked every congregate facility in our region, we want to do testing. We need to test your staff. We need to test your residents. And so forth for two reasons. One, those are our vulnerable populations. So how do we protect them? And number two, how do we get a baseline of surveillance in the community? So I guess, we flipped from thinking like, let's, wait and be prepared for the surge to come to the hospital and thought about how do we get out into the community? How do we get out to where the surge could potentially come from? And maybe intervene, a whole lot earlier. Fortunately, we didn't find any other positives in any of those facilities. I think we remain really ready for whatever might come our direction. But, I think we were able to prevent, a lot more people from getting infected by the disease. And actually probably saving lives in that process. And of course, today now with schools opening up, the communities opened up, all of those kinds of things, we are seeing, pretty significant increases in positive testing in our community. And we remain ready, from a hospital perspective, but we're also keeping many things in place to protect those vulnerable populations.
So you really, instead of in many respects acting like a hospital, you took on a public health function for the community, which, I've talked to colleagues across the country, and many of us have really had an extension of being our local public health officers. So as you look back over these past few months, do you see the pandemic affecting rural healthcare workers differently than those in other more populated areas? And what resources are you providing to support your teams through all of these long months of uncertainty?
Right. You know, so in rural communities in our facilities, a lot of our staff wear many hats. They're multitasking in a lot of different kinds of roles. And as we were sort of preparing everything, for the potential surge, or what does COVID mean? We sort of started out, thinking and communicating with staff. We all have to be prepared to potentially go into roles that we may not, have been in before. And, so our first thing that we wanted to do was to protect our staff. That is our most critical resource. And if our staff were getting sick, and I think we've all seen sort of the data around, 10% of, healthcare workers getting infected and or exposed, and then they're out on quarantine and things like that. So we put a lot of effort into just protecting staff, making sure they had the right PPE, making sure the training was there, for how to use, PPE and all of those kinds of things, and to help actually bring down their own stress levels, that we have to trust that good use of our PPE would protect them when they did take care of COVID positive patients in our hospital. We did a lot of cross training, for other areas. We had a labor pool. So even as we didn't see big surges and then we saw drops in volumes, we could redeploy our staff to areas where we did need them. And people were very flexible, with all of that. We did remote working environments, for people whose jobs, aligned with that and were able to do those kinds of things. We allowed, if we had any staff who felt that they were at risk or very uncomfortable, personally, they could take a time off, or we could redeploy them in a different area. We had flexible work schedules, all of those types of things. And we also, so that's kind of the work environment, if you will, and making sure we could still take care of patients and so forth. But some of the other things that we needed to do because of what was going on sort of in home life and having good balance for people, is we had an employee relief fund, to help people, with different kinds of expenses. We redirected all of our wellness resources really around how to, help people with that stress and anxiety about, what if they, got infected, or a family member, how to protect their families. We allowed people to go into negative PTO balances so that they knew that they could take time off and have, an income. We helped source childcare because the schools got closed and, we needed them to be at work. So how could we, help them with that? And we also had some alternative housing with the local universities. We used one of the dorms to provide housing for people who were working with COVID positive patients in our hospital, but they didn't want to take the risk of going home if they had other family members that might be at risk. And then I think, really fundamentally, it was about communication, just making sure, we had really open lines of communication to address concerns, answer questions, provide, good, accurate data or guidance, to staff. So, I think, these are the essential workers, today, and taking care of them has to be, really our top priority.
Yeah, I'm struck that listening and communication are two of the most important skills always, but have really come to the forefront as we've gone through this last several months.
Absolutely.
Now, I've heard you talk, and I know that Winona has been progressive and leaning into AI and other innovative technologies. As we continue to move forward with this pandemic that we're still in the middle of for the foreseeable future, are there any new services or innovations you've initiated that you think may now be here to stay?
We've, technology became really core, and I think will continue to be something that is going to change the landscape, not in little ways, but in like leapfrog sorts of, breakthrough ways, I think, in the go forward. I think the horses are out of the barn, with this one. We were doing, some telemedicine, before in a couple areas in a small scale and all of that. So like everybody else, I think when the waivers came through and all of that, that was sort of a real, breakthrough opportunity. and, our physicians, took advantage of that to take care of their patients, and patients liked it. That's dialed back a bit right now, because I think what we know is it works really well and patients liked it, but patients also really value their face-to-face time with their, physician. And so many of them wanted to come back and see their provider in person. But I think there's a calibration that we're going to go through to figure out where and how much, and how do we use that telemedicine. We have a smart exam, which is an online, visit. It's an asynchronous tool. And we just added on that, a free module to do online COVID screening. So, we pushed a lot of that out so that, people didn't have to, come into urgent care or have an appointment or something to, do an assessment of themselves. They could kind of go through this screening, and then it would direct them. Yes, you should go into urgent care. You should get tested, that type of a thing. We did a virtual urgent care. I think, again, workforce redesign is a whole big piece of, the technology component about how we can not just think about, the remote working, but how do we just entirely redesign, what we think about of, as the work week and the work, how work is designed and how can it be done, and how much more.
Hey, Mindy, we're having a little bit of a technical difficulty. We'll edit this part out, but we're just going to try to bring it back on.
It's always something.
They're trying to get her back.
I've lost her feed. Hello.
Hi. I'm not sure what happened there.
Well, let's see. You were given a great answer about innovative technologies.
So yeah, so just pick up where you left off, and what we're gonna do is because this doesn't go up until 3:30, so we're just gonna sort of edit that little bump out. It'll be fine.
Do you know at what point it actually went off?
Well, I know you talked about the asynchronous tool. I know you talked about another tool right after that, and then I think that's about when it left.
Yeah.
Okay. 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 So one of the things I would recommend that, really everybody do, because I think when we think about innovation, we try to think of like really novel new things to do. But we've spent a lot of time with our staff going back and capturing, all of our lessons learned in every single department and every single role. And in that, because people were really, sort of problem solving in the moment, and there were so many, really great ideas. There were great innovations. There are things that just became the standard of how we do things that were captured in those lessons learned. And then we step back from that and, look at sort of the bigger picture. How has that sort of shifted us, as an organization, in how we might deliver care and how we can think about, our interactions with patients in the future, how we might reach them in having more choices, more avenues to be able to deliver care. So I know we've talked about this in some other meetings, Mindy, but the premise around this is how do we never put ourselves in a position to have to close down services again? And so I think that's where sort of that innovation piece, comes into play. We should have learned a lot over these last couple of months and take those lessons and ensure we've positioned ourselves really well to always be here to take care of our patients.
Yeah, I couldn't agree with you more. I mean, we care for COVID patients and we take care of all of the other non-COVID patients who need our help.
Yes.
One last question. As we head into the fall with cold and flu season, and as the pandemic continues, what messages do you feel are crucial to share with your local community? And how can we enlist our local communities to really be an active part of the solution?
So I think, we are planning right now in terms of looking at the fall that there's going to be a lot of confusion. We're going to have the flu, we're going to have strep, there's still going to be COVID. People are going to wonder, what is it? Other respiratory types of illnesses. And so I think, as much as we can do to be very clear in our communications, working with our community partners to ensure that we're all on the same page about, infection prevention, because those actions, whether it's masking, hand hygiene, social distancing, all of those kinds of things will help with all of these sort of infectious, diseases and so forth. So making sure, that our communications are good. We're doing a full-on, court press with our community partners around getting flu shots, as soon as we've got the flu vaccine available. One of our messages is really around protecting our most vulnerable. So as people are moving around the community, some people could get COVID and not be impacted too much by it, but certainly our vulnerable, populations, it's life-threatening. And so, really understanding that this pandemic is about community. It isn't about just if you get sick. It's about who else could get sick because you are. So I think we want to encourage a lot of questions and discussion. I think that's been really helpful in this entire experience with our community. Getting, accurate information out, constantly being open to questions. Just neutralizes all that fear factor, that's out there. And we've seen really good adoption, by people to, really adhere to good practices when they understand why that is so important.
Well, Rachelle, thank you so much for joining me today and sharing your insights on how Winona Health has been navigating COVID-19 as a rural provider, and for sharing your thoughts on how we can all move forward in a manner that preserves and even strengthens our ability to care for the health of our communities. So until next time, thank you to everyone for joining us today. I hope you'll be back for our next Leadership Rounds conversation on September 10th. At that time, my guest will be Dr. David Zaz, CEO of MUSC Health in Charleston, and a pulmonologist. Our topic will be the flu season. Until then, stay safe and be well. Thank you.